Ken Walker has a brain tumor, but the chances are that by the end of tomorrow, a new kind of radiation therapy will have killed the tumor in a single treatment.
Initially, when the doctor said, "Would you like to try it?" I said, absolutely. The traditional radiation would probably be every day for 6 or 7 weeks, which is kind of, from a life going on with your life, difficult to work in. This has the possibility of being a one and done, so it sounds great to me. I'm all for it.
Exactly. It's just
8 a.m. the next day at Boston's Brigham and Women's Hospital. It's a startling scene as doctors prepare to attach a metal ring to Ken's head. It's essential for the ring to stay in position throughout the day, so they'll use blunt plastic pins to tightly clamp the supports to his skull.
Mr. Walker, all right? So what's part of the day?
It may look like medieval torture, but Ken feels no pain. In fact, the little lumps on his forehead are filled with a liquid painkiller. Neurosurgeon Eben Alexander developed this treatment, along with radiation therapist Jay Leffler on the right.
Yeah, let's check that again.
They'll use the ring and this metal cage which fits onto it to find the exact position of the tumor.
You got it all in.
8:15 a.m. Ken's going to have an X-ray called a CAT scan.
Okay, now we'll hold your head. I want you to relax your head. Relax your neck.
It's routine for most large hospitals, but here the team will add a special feature. As Ken's wife, Gloria, looks on nervously, the metal cage has been fastened securely to the ring. Now it will show up on the X-ray and provide fixed reference points for precisely locating the tumor. It's like putting a grid of lines on a map to allow a map reference to be read off. The X-ray procedure begins. In 20 minutes, the machine will take a series of pictures through the head. The pictures are arranged in slices 1/8 of an inch thick, piled one above the other like the floors of a building.
Parts of it is really going to be about the same plane. You're starting to see some there.
The tumor shows up as a dark shadow just behind the left eye. It's clear to the doctors and to Ken's wife.
That's not really cyst at all. That's part of the team. We'll probably target a little bit on.
With these pictures, the team will work out the exact shape, size, and location of the tumor, and then plan the therapy.
There is something maneuvering.
We can go on
The planning's going to take several hours. So now for Ken comes the most difficult part. Just sit and wait with the ring still in place. It's the vital reference point needed for the treatment later today. The team moves over to the computer system at the nearby Dana-Farber Cancer Institute. Eben Alexander begins work.
Right now what we're doing is just marking in the contours as we see them here of the tumor itself. What this enables us to do is to come up with a three-dimensional reconstruction in space.
Eventually, the computer will have a complete picture not only of the tumor, but also of the eyes and other critical structures nearby that the treatment must avoid. Here, the optic chiasm, the delicate structure where nerves from the eyes join together, is being mapped. And here they're marking out one of the optic nerves, another critical structure. After 3 hours spent marking out every X-ray picture, it's clear that the tumor is dangerously close to 2 critical structures. They've got to be left unharmed by the treatment.
So here is our real challenge, is right here. Because right here we have the tumor itself, and then immediately within 4 to 5 millimeters away is something that we don't want to give any radiation dose to. Tumor will give maximum dose to, and the optic nerve and chiasm, very low dose.
It's 2 in the afternoon. The planning session is now being led by physicist Hana Kui. It's his job to work out how to safely direct the radiation at the tumor using this 3-dimensional computer map. It shows the tumor in blue, and close by, the critical structures, all precisely located above the circular metal ring, which Ken is still wearing. If Ken were going to have conventional radiation treatment, his entire head would be given a small but damaging dose every day for a couple of months. It only works because the healthy parts recover more quickly than the tumor, which gradually dies. In contrast, the new treatment will use concentrated beams of radiation directed just at the tumor, possible only because they can fix its position so accurately. A single treatment will kill the tumor. In the planning session, they're now trying out different pathways for directing the radiation beams at the tumor.
Unless you have the neuro batteries here.
The computer keeps track of places where a beam would pass through a critical structure. And it becomes clear that getting enough radiation in to kill the tumor will inevitably mean some exposure of the optic nerve.
At this point, we have to decide, given those set of beams and placement of those targets, what is the actual dose we will be delivering to the tumor, and what is the actual dose that we'll be delivering to a critical structure.
Here, the computer shows in red the high radiation dose area. The tumor's covered, but so is a small part of the optic nerve. There'll be some damage, but not enough, it's judged, to harm Ken's vision. It's now late afternoon, and the constant pressure of the ring has given Ken an excruciating headache. It's turning into a very long day.
Well, it's real hard to look at them with that device on. I'm not real good with needles or anything like that, so I always have to look away with IVs or anything, so this is not a real pleasant visual appearance.
This morning, the anxiety had to do with putting this contraption on, and I'm not at all anxious about getting the radiation treatment. I'm just anxious about getting this thing off.
Another inch or two.
Finally, at 6 o'clock, it's time for the treatment. The ring is locked into position. Now the tumor inside Ken's head has become a precisely located target that the beam from the radiation machine will be able to reach with pinpoint accuracy. There's a quick run-through of the moves which the team spent the day planning. Then it's back to the control room for the real thing. There'll be just 20 minutes of exposure.
2.91 going to 3.
Ken will avoid entirely the unpleasant side effects which would go with conventional long-term radiation treatment.
When he leaves that room, the tumor has been altered in such a way that it is now essentially dead. So this has a very dramatic effect on the tumor. And just with this 1 20-minute trip into that room, we're going to kill the tumor.
The treatment itself is virtually automatic. Except for the tumor, nothing's going to change now. But somehow it doesn't seem that way.
It's probably the most nervous part of the whole thing. Just waiting and knowing that it's really going on, that this is the whole reason why we came here. Yep. So I'll be glad when it's all over.
It quickly is. Now the moment Ken's been longing for.
Take it easy for a moment.
Okay.
Relief, though, is not immediate. He's got the worst headache he's ever known.
One of the problems with the frame when it's on all day is where you get used to it being on. And when you release the tension of it, sometimes that's the worst time for the headache. And this kind of pressure headache will go away very quickly.
And the next day, Ken had no problem keeping an appointment with our cameras.
Just after I got the ring off, I was feeling pretty poor. But within, I guess the doctor said within an hour or so, most of it would go away. By the time we got down and got the taxi, got back to the hotel, I felt good enough to go downstairs and eat dinner.
It's a good feeling to know it's all over and done with, and it was successful, and he's feeling better and all one piece, and it's great.
There are just a few places in the world where this kind of high-accuracy treatment is possible. But for Jay Leffler, that won't last long.